Hi, good afternoon. Welcome to this special report from the Washington Post. I'm Libby Casey, the anchor for politics and accountability, and I'm broadcasting from here in Washington, D.C. Today, the president's claim of taking hydroxychloroquine has alarmed health experts, and we're going to talk about what we actually know. Also, restaurants are wrestling with how they reopen as rules relax, but there's a big question about how people will use bathrooms. But first, here's some of the latest news that we're following. Here are some of the top headlines. More than 1.5 million cases of coronavirus have now been recorded in the United States, and the death toll is nearing 90,000. Chinese officials said President Trump was trying to shift the blame for his administration's incompetent response to the coronavirus pandemic. And the comments from the Chinese came just a day after President Trump threatened to drop out of the World Health Organization and permanently end American funding to it. And all 50 states are now in some phase of their reopening process, and they're all at different stages. Now, of course, many public health officials and some politicians are urging caution. Well, my first guest is food reporter Tim Carman. Tim, it's so great to see you. And as we talk about states reopening and what that looks like, a big question for restaurant owners is what do they do? How do they do it safely? And will the customers come? Now, there was a meeting at the White House yesterday among leaders in the restaurant industry and White House officials. First, tell us about who in the restaurant industry was there.
Sure. It's good to see you too, Libby. So there were 10 restaurateurs there, and they represented sort of the high-end and chef-driven restaurants from chains like Burger King and Wendy's down to, well, I shouldn't say down to, but to a really high-end gastronomy restaurant like Per Se in New York. And they were there really, I think, pressing the case mostly for a couple of things. They wanted to extend the pay period. Many of them got PPP money, the Paycheck Protection Program money, and they have only 8 weeks to spend this, and mostly on payroll. And they're really pushing the government hard to extend the terms of this money. They want to extend it to 24 weeks instead of 8 weeks. And I think they would also like to spend a higher percentage of that on, rent, on suppliers, and not make it all just about payroll. But they also wanted to look at, as restaurants start to reopen or think about reopening, they're looking at a landscape that's so different than when they closed, or even different from January, February. And they know that a very small percentage of their usual diners are going to come back. So wow. They know that they're not going to make the same amount of money. Some are predicting as low as 20 to 30% of the usual revenues. So they're looking to the government to help them make it through this transition period. And
I just want to point out that the Payroll Protection Act that you're talking about, is so important to many businesses, but it does need to be spent, the bulk of it, on payroll. And if a business is able to do that, then it essentially turns into a grant, right? They don't have to pay that loan back. But if the terms for the loan go forward and they haven't been able to spend it all on payroll and it's time to pay something back, that window is shrinking. So, it is important to point out that there was this a unified voice that the president seemed to be sort of struck by. They're all unified in this, saying we just need more and we need more time.
Yeah, that's exactly right. They need more time. And, there's this idea that why do they need to hire all of their employees in an 8-week window when most of them aren't even open at their former capacity? So it doesn't even really make sense. There's actually a restaurant here in the DC area that took PPP money, and they hired back some employees to do car washes. So, it's sort of, not even doing the function of what restaurants do. So, but they feel like they need this money to help them get over this hump. And they also feel like they need a liability insurance. And I think this is an important point. They, as they reopen and take a risk of reopening to a public with no vaccine, very little, trace back testing. What's it going to be like if someone gets, COVID-19, they suspect from a restaurant and sue them? Are the restaurants going to be liable? So they're looking for, liability protection. And the president yesterday seemed to indicate that he would be open to that.
Mm. You know, you point out in your story that the statistics are just not good. That the National Restaurant Association has some pretty brutal stats on how many hospitality industry employees have been laid off or furloughed. We're looking at more than 8 million workers. 4 in 10 restaurants are closed. And we're talking about, hundreds of billions of dollars in lost revenue this year.
Yeah, it's terrible. And the predictions of how many will actually come back, it's not good. Ranges from 30 to 40% might not make it back. Tom Colicchio threw a number out yesterday, and maybe he was just exhibiting his own fears here, but he said 80% might not return. But I think whatever number returns, it's going to return to a landscape that no one really knows what it's going to look like. How many people show up? Are they going to enjoy themselves at the restaurant? Is it going to be an environment that they want to keep coming back to, or will it just be one thing they want to see if they like? I mean, but it's all different in different jurisdictions too. It's like, we saw the stories out of Georgia where people were showing up in restaurants in fairly large numbers, no masks, making it look like it was just, a nice spring day in Georgia. And then in Alaska, in order to go to a restaurant, you can only be from the same household, and you can only have 4 people, so they can do easy tracebacks if anyone gets sick at the restaurant.
Mm. You mentioned Tom Colicchio. I just want to say, so he is with the Independent Restaurant Coalition. He's sort of, very prominent voice in the restaurant industry. Even though we saw a wide swath of the restaurant community represented there, it was mostly white. It was male. There wasn't diversity in terms of the ranks of who was actually allowed to attend.
Yeah, and this has been a real sticking point with a lot of independent restaurateurs. There were people messaging me yesterday just saying, they've at least expanded it from the original conference call with the president in March, where it was just chain restaurants and like huge chain restaurants. So now the independents have a seat at the table, but it's still like independents of a certain wealth and price point. We're not talking about the people who represent the small mom and pop shops that just have a corner 20 table restaurant in a neighborhood where you live. They have far different concerns than the chef who runs Per Se, or the chef who runs crafted hospitality. And these people feel like they're not being heard. And to the chef's credit, I think the people of the Independent Restaurant Coalition, they feel like they are speaking for everyone, and maybe they are, but I think the folks down at the grassroots level, they fear that they're not.
And you reported the IRC tried to send a woman chef restaurateur from North Carolina, but she was rejected by someone at the White House, they say.
Well, this has been interesting. I've had some conversations since Tom told me that, and it's still not clear to me exactly what happened. But so Will Jadara, who is the former general manager at 11 Madison Park, he was apparently always supposed to go. Still not confirmed if that's exactly the case, but he was always supposed to go. But the IRC looks like they may have seen all the participants list and saw that it was all male. So they then asked the White House if they could bring in Katie Button from North Carolina, who's a very reputable chef in North Carolina. And either she was not approved or they never got back. Mm-hmm. But I mean, either way, she wasn't there.
Mm-hmm. And the reason why we're pointing this out is it's like who is the White House listening to? Like, which voices have a seat at the table and are being heard? Tim, I'd love to know what voices you're listening to. I was thinking back at talking to you for a video project we did a couple of years ago at Nats Park, trying out the ballpark food on opening day. And what a very different experience that was. We were surrounded by so many people, and our photographer was like crammed in among the crowds, and we were like sharing plates. What a different world.
What a fun day that was, though.
Yeah. that seems like a lifetime ago now. And I'd love to know sort of who you're talking to, who you're listening to, what types of people in the food world are you listening to who are grappling with these questions of reopening and what they do next?
Well, I've been trying to reach out to many, many different restaurateurs, um, everyone from like the owner of a small Middle Eastern restaurant in Oakland, California, to Tom Colicchio. I just spoke to yesterday to the owner of Busboys and Poets.
Mhm.
He runs a small chain of restaurants here in the DC area, and despite whoever you talk to, it's basically the same issue. Um, their ability to survive is going to depend on a number of things. Their ability to um, be flexible, to come up with different revenue streams, maybe do more takeout, develop different menus for takeout. But they also need help, and they all say it. And I think they're one of the main sources they're looking for help is their landlords.
Mm.
And some landlords apparently have been great, and some are still waiting for I don't know what. I'm hearing that from some restaurateurs that they've had conversations, but nothing has been in place. And I've also heard from others that some landlords may just be waiting this out to see what restaurants have the wherewithal to withstand this pandemic and survive.
Mm. So President Trump didn't give a sense of if the restaurant industry would be seeing sort of more of a cash infusion, but he did sort of brag that he had already saved the industry. So do we know what the president was talking about?
Um, I have no idea. Colicchio didn't know. Maybe he thinks the PPP has provided enough safety net for the restaurants, but any restaurateur that you talk to, uh, they they don't see it that way. There's just so many limitations. I know one restaurateur that has not even used her PPP money. It's still sitting in a bank account because she's not sure she wants to use it. She was not sure she can afford to have it convert to a loan. Because as you mentioned earlier, like if they don't use it under the right terms, they have to pay that money back. And in her case, it's like $100,000+ that she has to pay back in 2 years' time. 2 years' time, $130,000. That's a lot of money to pay back in a very short amount of time.
Mhm. So you've also been reporting on the battle that's really brewing right now between restaurants and insurance companies over unpaid claims. And this is fascinating because, for a restaurant that's lost a ton of business, insurance, right? If you have insurance, you can think, aha, this is exactly what it's for. I have insurance to protect my business from, disastrous circumstances that are perhaps beyond my control. But the insurance companies see it very differently. So what's the fight here?
So it is complicated, but it boils down to that, about 30% of small businesses, including restaurants, have bought specific insurance for business interruption, which pays, a restaurant in this case, money for income lost and for other expenses. And some of these have bought specific policies that protect them during viruses, that protect them. What they say is all risk policies, covers anything. And there was no exclusion for viruses, which a lot of policies included after the SARS pandemic in 2003. So they feel really blindsided, the people that bought these kind of policies, because the insurance companies aren't paying them out for usually one basic reason, because they see business interruption as you have to have physical damage to your property. And none of these can say that, right? I mean, the reason that they can't operate to their capacity is because the government has shut down their dining rooms, and so they can't have anybody in their house or in their dining rooms. But then they're also just reduced capacity. So they've been turned down for that reason, and they have gone to the courts to say, okay, listen, our dining rooms don't have physical damage, but they're a dangerous place. And here's the reason why it's a dangerous place, because you put 40 people in a dining room, it's suddenly during this time frame a very dangerous place. and we can't do that right now. So they're going to look to have some judges, because I think they're all trying to do a summary judgment where a judge makes a quick decision on whether these policies actually cover business interruptions during pandemics. And I think they're hoping for a quick resolution, but I wouldn't bank on it.
Well, Tim, one of the hurdles to restaurants reopening is the bathroom, because any business that has to reopen that has a bathroom has to figure out not just how they're going to distance tables and have a server wear a mask, but how people are going to go into that space where there are a lot of germs being passed. And so we are lucky to have Mark Fisher with us, senior editor, who wrote a story that I've seen posted so many places, Mark, about how businesses are dealing with bathrooms. So Tim, we will let you go as we transition here to talk about sort of the very back end of the house of restaurants and other businesses. Thanks so much, Tim.
Thank you.
So, Mark, who is asking the question about what we do about bathrooms? Is it businesses? Is it customers? Is it governments?
It's primarily customers and businesses. Some businesses anticipated this and began as they began thinking about how to reopen. This was very much in their thoughts. Others have kind of had the shock of recognition when customers say, well, I'm considering coming back, but what's going to be the situation with the restroom? And in fact, they hear that from some customers, but with many other people, this is kind of an unspoken anxiety. And we don't talk much about restroom design in this country, certainly not as much as in Asia or Europe. And all you have to think about is your friendly gas station restroom, and you immediately get this sense that things are not quite up to the same level of quality that other countries may have produced. So this is something that high-end restaurants have always thought about. Other restaurants, maybe not so much, and other facilities, everything from beaches to public parks to movie theaters, drive-in movie theaters, which were originally considered one of the first places that should reopen because you're sitting in your own car. What could possibly go wrong? Well, 3-4 hours into a double feature, something could go wrong and you have some needs. And if the facility has not been cleaned to your satisfaction, that's going to be a real obstacle to people paying and coming out of their houses after all this time.
So you report on a bunch of different businesses and how they're thinking about their bathrooms. So what are some of the innovations or very practical steps that companies are taking?
Well, there are expensive steps and there are cheap ones. The expensive ones involve a wholesale retooling of bathroom facilities, taking out some of the jammed together urinals and toilets, actually removing some of the sinks to create more space for social distancing. That's obviously a big ticket item. There are other kinds of innovations that can help. Certainly the hand dryers, the blower dryers that have become basically the rule in many higher end retail and restaurant establishments. Those turn out to be just perfect germ spreaders. And a lot of people kind of knew that before, but didn't really pay much mind. Well, now all of a sudden, this is really a crucial issue. So you're seeing those decommissioned at a remarkable pace. Sometimes they're actually being ripped out and replaced with paper towels. In other cases, they're just taped over. A plastic bag is taped over them, and a pile of paper towels takes their place. And then there are just the cheaper, more easily visible kinds of changes. I talked to a lot of business owners who said, look, I don't have the money to change out my entire bathroom facility, but I can hire a low-paid bathroom monitor, a person who will stand there and either distribute paper towels or, more important, stand outside the facility and make sure that people are spaced apart, make people feel like they're not going to be jammed up against other folks who are waiting in the queue if you have reduced the number of people allowed into a multiple stall restroom at any time.
Mm. You talked to a professor and also the president of the American Restroom Association. I paused because I wanted to get the exact organization correct, because believe it or not, I'd never heard of this organization before. My fault, not theirs. So you talked to this gentleman who is also a professor of social work, and he talked about how we have some legitimate sort of fears and concerns, and then we have like other anxieties that are just sort of more fear-based and more imaginative. They're not reality. But in this case, it kind of seems like they collide. Because there are some actual concerns, not just sort of like icky feelings about how germs are spread right now.
Well, that's absolutely right. And some of these are just plainly obvious. If you're standing immediately next to someone at a sink or a urinal and there's a cough, I mean, obviously that's going to be upsetting to a lot of people. But then think about the stalls. We do not have European style floor to ceiling dividers that you see in many parts of the world. And we don't have them because it's easier for cleaning crews to clean if there's an opening near the floor, and also because it's cheaper. And so that's now turning out to be a disadvantage of the way we design bathrooms in this country. There's also a question, most public restrooms are not equipped with lids on the toilets.
Right.
And that's for people's convenience, and people don't like to touch things in the bathroom, so you don't have the lids going up and down. But as it turns out, the high pressure flushes in public restrooms are perfect ways for spreading in aerosol mist. And we know that this virus travels in an aerosol mist through droplets and so on. So, and we have just studies we've reported on the Post in the last week about how this virus can be transmitted through human waste. So you put two and two together, and all of a sudden that high pressure flush seems like a danger. So you're going to see a number of public restrooms now re-equipped with lids on the toilets. Not an enormous expense, but the kind of fix that perhaps no one would have thought of just a few months ago.
So I also want to mention people who are used to using public restrooms as part of their daily life: truck drivers, delivery people, and then the homeless. And they're having to face the tough situation right now of not having access to public restrooms.
Right. So the question of availability of public restrooms has been really front and center over these last couple of months and continues to be even now as we see in some states the reopening of beaches, public parks, and so on. Some of those are reopening without the bathroom facilities opening in those public parks. And that's because they don't have the staff, or they haven't re-equipped the bathrooms in the way that we were just talking about. And so there's a real disconnect between you're opening the beach, but the restrooms aren't open yet, and they haven't been re-equipped yet, and they haven't hired the folks they now want to hire to make a bright public show of having those facilities disinfected on a regular, ongoing basis. So I talked to a number of town managers and parks facility managers around the country who said that this is what they're focusing in on now. It's a financial problem for a lot of those small towns. That beach resorts tend to be very low budget small towns, and they don't have the money to hire a whole bunch of bathroom monitors and professional cleaning services and so on. But some of them are beginning to do that. And so you're going to see this summer, as some of those resorts reopen, that those communities have stepped up their game when it comes to public restrooms.
Something we'll all be thinking about a lot more. Mark, and I mentioned people who use public restrooms. You also point out, of course, police, first responders, people who are sort of driving around. I want to leave us with this. You did talk to someone who's trying to sort of be entrepreneurial about this and find some solutions.
Yes, absolutely. As we've talked to people about the difficulty of getting into public restrooms, and then the sort of scary situation that some people may find when they get there, this is, as you said, police officers who are working all night, healthcare providers who are, home health aides who are on their way to and from work. All these folks who are essential employees need a place to go. And so there are some entrepreneurs, I've been hearing from a lot of them today, who have various products out. We talked to a couple in Prince George's County, Maryland, who have a thing called the restroom kit, which is the size of a deck of cards, and inside it you have everything from wipes to a toilet seat cover to toilet paper, so you can go into a public restroom with some confidence that things are going to be a little bit better than you might expect at your average gas station.
Mark Fisher, senior editor, thank you so much. It's so good to see you. I'll bring in our other colleagues, Philip Bump and Felicia Sonmez. Philip and Felicia, news you can use right here at the Washington Post. Mark, thank you. We'll let you go.
Good to see you.
So I have no graceful transition. We'll just pick up a new topic here. Felicia, you've been reporting and following on the breaking news over the last couple of days. And one of the big stories that came out of the White House yesterday was President Trump sort of making an offhand remark that he's taking hydroxychloroquine. And it was one of those things that made everybody sort of stop and listen up. Tell us about how that unfolded and why it was surprising news.
Yes, the president volunteered this of his own accord in an exchange with reporters at the White House yesterday. And with that one pronouncement, he really did shake up the whole political world, and indeed the whole country right now, who is in the midst of this pandemic. With that announcement, Trump made clear that he's been taking hydroxychloroquine, which is an anti-malarial drug, for the past week and a half, he said. Now, the timing here lines up with the start of him taking it is around the same time that two White House aides, it was announced that these two aides had tested positive for COVID-19. So in a letter late last night, the White House doctor made clear that he had had conversations with the president about those two cases. The doctor didn't necessarily say that he had prescribed this drug to the president, but he made clear that in his own and the president's view, the benefits of taking this drug outweighed the risks. Now, that is quite in opposition to what the majority of the medical establishment says. Hydroxychloroquine has numerous side effects and could be potentially fatal in many people who use it. And so after the president made that announcement yesterday, the majority of the reaction was really shock and alarm that he was going to be promoting this drug to the general public.
Yeah, Philip, you wrote a piece that with the headline calling this a stunning claim, and your reporting warned that it could trigger a cascade of negative effects. So, Philip, to you now. Let's be clear: the president says he's taking it, right? We don't have any proof that he's taking it. But what is the danger here?
Well, I mean, the danger fundamentally is when you look at what the FDA has said about this drug, right? First, they gave it an emergency use authorization so people could sort of see how it worked before clinical trials were done. What they have since said is, hey, we're issuing a warning that this should only be used in the hospital, for example, where someone can be monitored regularly as they're using the medication because it can lead to problems with people's hearts. Obviously, Trump is someone who's going to be monitored all the time, so this is probably less of a concern for Trump. The real concern is this is part of a pattern of President Trump undercutting experts in the government. The experts say you should wear a mask. Trump says, I'm not going to wear a mask. The experts say we need to very slowly reopen. Trump says, let's reopen all our businesses and get going again. This is a case where the FDA is saying, hey, you really need to be cautious in using this thing. And Trump's saying, And he literally said, again, what have you got to lose, when the answer is some people could lose their lives. And the concern really is that the people who follow him and listen to him and his key supporters will say, hey, you know what? He's taking it. He's doing fine. He says, what do you have to lose? I'm going to try and seek this out myself as well.
We had a question come in from Fran, who wrote in from Wisconsin and asked, why is the president taking this controversial drug if he doesn't have coronavirus? Felicia, do we get resolution to that or an answer to that in that letter that came out last night?
We didn't actually get resolution on that. The White House doctor confirmed yet again that the president has tested negative for COVID-19, as he has done repeatedly over the past several weeks. So it's really unclear. As Phil mentioned, this is not a drug that's been recommended to be taken outside of very controlled environments, either in a hospital or in a clinical trial. So certainly for the president to be taking this as some sort of precaution is not medically advised. What we do know, my colleagues at the Post have reported that there's a group of people close to the president, including his personal attorney, Rudy Giuliani, and a number of doctors in New York, who have been making that case to him privately that hydroxychloroquine is a drug worth considering. So most likely those are the people who have the president's ear right now on this. But it's a bit of a mystery from a medical perspective why he's deciding to do this right now.
You pointed out the concerns of the FDA. Well, the NIH, so President Trump's, own National Institutes of Health representing the United States of America, has warned against taking hydroxychloroquine. It talks about the concerns about high doses of it, having bad side effects. So many concerns here coming from not just people outside the federal expertise, but from inside it as well. Philip, the echo chamber of Fox News and the White House is very significant because it's influential and powerful. But you point out that Neil Cavuto, one of the Fox News hosts, was sort of surprised and astounded and critical of President Trump's comments yesterday, and that created a bit of a rift.
Sort of, yeah. I mean, it created a rift between, or I shouldn't even say created, it exacerbated a rift that exists between Cavuto and Trump. Cavuto's been one of the people on Fox and Fox Business who's been more willing to criticize President Trump when he says something that is obviously wrong or obviously problematic. To be totally fair, Cavuto's response was, if you take this drug, you will die if you're in these high-risk groups, which is an exaggeration of what the experts are saying by itself, but it certainly is closer to the risks that have been announced by the FDA and NIH and others than what Donald Trump said, which of course, again, is what do you have to lose? It's sort of fascinating, though, to watch this dynamic as there's this tug of war between Fox News and Donald Trump over that shared base of supporters. Fox News people, people who really watch Fox News a lot, tend to be very strong supporters of President Trump as well. And there's a fascinating poll that came out earlier this month in which Monmouth University asked people, if you have to choose, if you're getting information from Fox News and information from Trump, you have to pick which one you think is accurate. 2/3 of Republicans said they would pick Donald Trump's view over Fox News. So there's certainly, in addition to there being a tension between those two forces, Trump is winning that fight. And so it is problematic for Fox News when Trump comes out and says, hey, you know what, ignore what Fox News is saying, because a lot of their shared base will actually do that.
Felicia, you've been following the fight that's been happening between the White House and the CDC. And let's point out again, this is sort of all within like the federal, government umbrella. Why is this fight happening and what's significant about it?
Well, this fight really began brewing a couple of weeks ago when internally there were some members of the White House Coronavirus Task Force who were butting heads with members of the CDC over the best way to advise states to reopen. Now, as we all know, by Memorial Day, every state in the country is going to have partially reopened, but behind the scenes, there's a lot going on as far as the recommendations when you get down to the details of exactly how they should do that. And what we've learned is that my colleagues here at the Post had reported that the CDC had put forward a very lengthy, 6 dozen pages of draft guidelines for states to reopen. And that has essentially been held up at the White House over political concerns about how this would impact all different kinds of industries, from restaurants to religious organizations. And you've really started to see that conflict between the two come out into the open over the past couple of days. You had Peter Navarro, who is the White House trade advisor, went on the Sunday shows and openly criticized the CDC. He took them to task over their development of a flawed coronavirus test a couple of months ago, and saying that they held up this whole process of really being able to combat the pandemic. And then you had, less than an hour later, you had Alex Azar, the Health and Human Services Secretary, whose oversight includes the CDC, coming out against Navarro and defending the agency and saying, no, it's not fair to criticize them. So really, all of these internal debates have been bubbling up for a while now. We're just seeing them come out into the public. And what it seems to suggest is that the White House has been, on the one hand, trying to put the focus on China and put the responsibility for China for this whole pandemic. Now it seems that they're turning their focus inwardly to, in addition to China, to also try to blame a different part of Trump's own administration.
Philip, some of the conflicts that are coming from the federal government are leaving states to make their own decisions. Now, there are federal guidelines and recommendations, but states have decided to plow ahead even if they're not hitting the benchmarks outlined by the federal government. One notably is Georgia. We're actually watching, of course, at the Washington Post, just how states are opening. We have a map that shows how states are sort of viewing and looking at this process of what reopening means. But you've been looking at this question of the data and whether or not there are going to be surges in cases as states reopen their economy. Right. What are you focused on? What should we be looking at and tracking? Because we're hearing so much about, all the numbers.
Sure. So there are actually two benchmarks that the federal government established as being the ones to watch for when states were ready to reopen. And those were the number of new cases by day and the number of tests that were coming back positive per day. And those two are sometimes in conflicts. You've probably heard by now that, if you do a lot more testing, you're potentially going to get a lot more positive results. That doesn't necessarily mean that you're seeing a lot of more infections, but instead that you're just doing more testing. And so what we can do is we can actually look at those numbers on a day-to-day basis in each state and evaluate how each state is faring. So I did that actually last week, went and looked at Georgia, Florida, some of the other states, which are very quick to start reopening. So far, there hasn't been a noticeable spike in new cases in those states, which is obviously good news. There are probably a lot of reasons for that. One of them being that people in Georgia, we've seen data repeatedly that suggests that even though the state is reopening, people are still loath to go out and go to restaurants and do the things they normally would, obviously being aware that there still exists this risk should you surround yourself with other people. So we haven't seen big spikes there yet. Those are the numbers that I've been tracking, in part because those are the ones the federal guidelines stipulate are the ones that should be watched. It's either too early to tell, or it suggests that a lot of the social distancing measures and effectiveness that we've seen over the past few months is a function of people taking it upon themselves as much as, if not more than, what the government is saying.
That's a great point. It does seem like there's sort of a motivation right now to read data however the data best suits you, if you're a politician trying to sort of justify your arguments. So, Philip, are there particular states that you'll be watching or areas of the country that you'll be watching as we see this reopening process?
Well, there's this fascinating case that was reported yesterday in Florida, where the woman who was in charge of data for the Department of Health in that state was removed from her position shortly after the state reopened for business. And she actually sent a letter to her colleagues saying, hey, look, part of what I was doing, I was removed from my position because I wanted to maintain the objectivity of this data. I can no longer confirm that the data that the state presents will be objective. The concern that people in Florida had then is, hey, is the state manipulating these numbers in order to better make the case for remaining open? One of the things we really have to pay attention to is people are tired of the lockdowns. I think all of us can appreciate that to some degree. What happens if there is a resurgence? What happens if Georgia and Florida start seeing a bunch of new cases and the natural next step is, hey, we need to start constraining things again? There's not going to be a lot of public will for that. That's a tough position for elected officials to be in. And then the follow-up question is, do they actually present accurate data about what's happening, or do they try and give a best case optimistic scenario, as we've seen President Trump do any number of times, that then makes it harder to make the case for restraining again and adding new constraints on spreading the virus.
Paige Winfield Cunningham joins us now, health policy reporter, and she writes the Health 202 for the Washington Post. Thank you for joining us. I'm going to throw one question to the group here before we let Felicia and Philip go. Some people wrote into us just asking about these phased reopenings and, what it means if you live in one state versus another state. And Rosalind from South Carolina wants to know this. Why are there so many differences in the states? And also how stores within a state will handle reopening and change the rules. And she has concerns where she lives in South Carolina that people won't take enough social distancing measures, won't wear their masks, won't sort of take personal responsibility. So, Paige, let's start with you. What do you say to Rosalind, who's just trying to figure out what the right course of action is when she's hearing different things happen at the national level versus the state level versus her local level?
Yeah, well, I think one pretty uniform message that you've heard is that a lot of these decisions are going to have to be made at a local level as we go forward, because this is such a local issue. Like, we're seeing places where the cases are being pretty suppressed, other places where they're still growing. And so I guess I would say to her, she needs to take a look at, the area that she's living in and what do cases look like there and what do the risks look like there. And then I think a lot of officials are sort of urging people to, take stock of what their area looks like and kind of base their future actions on that. And I think you're going to see public officials do that as well. You've seen, the Trump administration emphasize that this is going to be, county by county, and you're hearing the same thing from even, the governor of California, Gavin Newsom, who's leaving a lot of these decisions up to counties as far as when to open schools and what to do with businesses and so on and so forth.
So, Felicia, there's such a question about what guidance will come out next, and we heard questions of Dr. Fauci and other health experts last week on Capitol Hill. Some, especially Democratic senators, pleading for sort of more guidelines, more specific, more clarity that can help make decisions. Do we have a sense of where that's at?
We don't yet, and I imagine it's still going to be some time before we really get more details on a national level. As Paige mentioned, I think that's one of the fascinating parts of this current environment from a political standpoint is the president's approach by essentially handing off the bulk of the responsibility here to the governors. He really has ensured that the way that people respond in New Jersey is going to be different from the way that it's handled in Arizona. And, my family, I grew up in New Jersey, and my family there all wear gloves every time they go out of the house. And of course, they all wear a mask. But even here in Washington, D.C., the way that we approach it on a day-to-day basis is quite different. So I think that on the one hand, it is a reflection of the circumstances on the ground. But on the other hand, you're going to have this patchwork across the country, and those national guidelines, as Democratic senators have been pushing for, really could provide some clarity, regardless of what point on a state's individual curve they are at any given moment. One final thought on that, which I've also found interesting, is the president has little by little been leaving the White House and making his way across the country to various events. So far, he's been to an event in Arizona, one in Pennsylvania. We're going to be seeing him on this Thursday going to a Ford plant in Michigan. And the one thing I'll be watching at that event is, does the president wear a face mask as he visits that plant? So far, it's been his MO to go without a mask. And of course, he and everyone around him are usually tested for coronavirus. That's been his defense. But Ford is maintaining that everyone needs to be wearing their personal protective equipment when they visit. So that'll be worth keeping an eye on later this week.
All right. And finally, Philip, just before you joined our program, you filed a story. Your filing rate is impressive, where you were looking at this question of how there's sort of conspiracy theories and questions around the number of deaths from COVID-19. And this is, is problematic to a lot of health experts, because if people doubt the death toll, they may be a lot less cautious and may not believe anything the experts are saying.
Yeah, that's exactly right. I mean, there is a concerted effort in some circles to actually try and downplay the threat that is posed by the virus, in part to make the case for reopening businesses more quickly and so on and so forth. So the article that just went up focused specifically on Laura Ingraham, who has repeatedly, she's a Fox News host, who's repeatedly raised questions about whether or not we're getting accurate information about the toll posed by the virus. She's also been very instrumental in hyping hydroxychloroquine, went to the White House with doctors to make the case to Trump personally. But what I did is I went back and looked, and back earlier this month, she had sort of touted this dubious article saying, oh, the CDC now says there's half as many deaths as there actually were. It was obvious in the time. Aaron Blake from the Post did a great story pointing out, it's obvious that that's not what's happening. The CDC is just slow to actually do these numbers. So I went back and looked at it in the 2-week since, how that actually compares, what the CDC's death toll is now compared to what the media was saying then, and the two basically match. And so it's just a way of pointing out, hey, look, when you hear these things, when you hear these claims that things are not the way they actually are, stop, take a step back, consider what it's actually saying. And if you actually look at it, 99% of the time, you're going to learn that actually what the data are is what the data are.
All right.
That's the weirdest sentence I've ever said in my life.
It made total sense to me. Philip, national correspondent, Felicia Sonmez, national reporter. Thanks so much to both of you for being with us. We're going to let you guys.
Thanks so much, Libby.
So, Paige, you've been reporting on and looking at this effort to sort of track coronavirus cases coming from outside the government. These are former sort of health policy wonks, as you put it, people who came from the Obama administration as well as the Trump administration. They're using simple color codes that we can all sort of wrap our minds around to look at the 50 states. Who's behind this effort, and what are they trying to do?
Yeah, so this is a group of folks, some of whom worked actually on the sort of infamous healthcare.gov meltdown and trying to kind of fix the website when it launched back in 2014. And I think what they really realized is that, we have all of this data that's coming out of the states, and you can get some of it at the CDC's website, and you get some of it at this coronavirus other website a lot of people have been going to, but it's not always put together in an easily digestible way. way. And it's really hard as a consumer, and I think even as a policymaker, to really kind of put all of this data together and get a really good sense of where each state is at in trying to stem cases, deaths, what is hospital capacity like, sort of what is the overall status of states as they're looking to reopen. And so this group of folks that I talked to took data from a couple websites and have sort of put it into like this consumer-friendly map where they basically give each state a color, red, yellow, or green, based on kind of a couple of different metrics to kind of give an idea of where they're at in reopening. And I've definitely found it helpful in my own reporting, but also really interesting to see that a lot of states, I mean, virtually every state is making moves to reopen at this point, even though they're all in very different places in terms of being able to kind of flatten that curve.
Yeah, I mean, you point out that the only states that were green at the time, North Dakota and Kentucky, meaning that they've sort of met the Trump administration's criteria for being ready to reopen, only 2 states. And that's despite the fact that all states are on some sort of forward path to reopen in some way.
Yeah, and actually the website has changed since then. I think they changed those states from green back to yellow, and a couple of other states are green. Part of this is really hard because the administration hasn't been real detailed in kind of what does that criteria mean. So, for example, they've said a state should experience a 14-day decline in cases. Well, what does that really mean? Does that mean that you need to see the number of new cases found each day go down for 14 days? What if it spikes for a couple of days and starts going back down? What does that mean? Does that kind of restart the clock on the 14 days? Or is the overall trajectory what matters a lot more? And another thing that's really hard in all of this and that kind of skews everything is that now we have a lot more testing. And that's overall a really good thing because we're getting a much better sense of who has the cases and where the cases are at. But it also kind of artificially can make it seem as though cases might be rising in a state when actually it might be the case that we're just capturing more of those cases through testing. So a lot of this data is really difficult to interpret in some ways. I would say because of that, a couple indicators that are really good to look at are, what's happening in a state's hospital and in their ICU units. And that's actually one of the metrics that this COVID exit strategy website uses, is looking at what percentage of beds in ICU units are filled, because that's a pretty good indicator of how a state is doing. The other really important indicator is what is the rate of positive tests out of overall tests performed. And so we want to actually see that percentage be going down because that would indicate that we're capturing more of the cases. On a national level, the good news is that we are seeing that percentage go down. When you look at individual states, some are doing well on that, others not so well.
We had a question written to us from Pat, who writes from San Francisco. Please explain how some organizations or states or governments can withhold the statistics of COVID-19 impact during a public health crisis. And she feels like there should be a law, obviously, to require reporting. So there have been, as Philip mentioned, some conflicts and concerns about the accuracy of numbers coming out of some states and then people being removed from their posts. So what is the justification there if states aren't sharing information or are sort of cherry picking their information?
Yeah, it definitely makes it hard to analyze. There is a role here for the federal government. And actually, there was an announcement yesterday out of CMS, the Centers for Medicare and Medicaid Services, that they actually are requiring nursing homes now to do much better reporting of cases and deaths. That, of course, is a huge area of concern. The estimates are that perhaps as much as 40 to 50% of the fatalities have been in long-term care facilities. But there's been a lot of that. It's hard to actually know because the reporting has been really poor out of a lot of the nursing homes. So I think that was one example of how the federal government can step in and say, hey, this is a really important, information that we need to have from states and localities and really step in and mandate that reporting. But absolutely, there are definitely some issues also with the data, just that the CDC is reporting. Scott Gottlieb, a former FDA commissioner, actually had an op-ed the other day really criticizing the CDC for not being more comprehensive and more quick to kind of get that data out there, in terms of, what the trends that we're seeing in cases. There are these reports of this illness among children, respiratory illness, but we don't have a lot of that data because the reporting has been poor. So there's certainly an issue there, but I think we are seeing some steps, at least at the federal level, to try to fill in some of those holes.
Paige, there was an announcement this week from the biotech company Moderna giving a status update on how its search for a vaccine is going. And the stock market liked what they heard. But I want you to give us a reality check on what we know about this process.
Yeah, so this is just, it's really important to understand that this is just the very, very, very first step of a multi-step process. It can take as long as a decade, a lot of times, for vaccines to go through the entire clinical trial phase, from the beginning, the safety trials, all the way to FDA approval. So we are talking about a hugely sped up process here. So basically what happened is that we have, I think, 14 vaccine candidates that were selected in March that seemed promising. The companies have started the phase 1 clinical trials, which usually are comprised of fewer than 100 people, and they're just sort of an initial trial intended to test the safety of the vaccine. And so basically what Moderna was reporting yesterday was some results from that first trial. They actually didn't even have the results of all 45 participants. They just reported results, which were promising, from 8 participants, seemed to show that they had developed antibodies in response to this vaccine. So we still need to hear the results of the rest of the people in the trial. But it seemed promising enough that the Moderna's they're planning to actually start the phase 2 trial next month, and then they're saying phase 3 trial in July. And those 2 trials will progressively include larger groups of people. So phase 2 would include up to 1,000 people. Phase 3 trials typically involve several thousand people. And then, after that, there would be a lot of FDA review steps. Of course, President Trump has promised a vaccine by the end of the year. A lot of people are very, very doubtful that time frame is practical. So I would say people should take the news from Moderna as good news, but recognizing that this is just the very beginning of a long process.
Another great question from Kat in Maryland, who says, we keep hearing about a second wave in the fall, but is there even an indication that cases will subside during the summer, really ending a first wave? Or is this all just going to blend together, Paige? What are the health experts saying?
I would say that we're just at the beginning of even knowing that. I mean, all of this data is delayed, right? It takes a couple of weeks to even know what the trends are for cases and fatalities, and we've seen the lockdowns lift just in the last couple of weeks. We have some initial promising indicators. However, I will say I don't think anybody's really expecting that. We're not going to stop transmission of cases entirely. Like, I think everybody's sort of come to grips with that reality. We are going to have some, having to figure out what is our new normal with coronavirus. The hope is that the states have bought enough time now to have the testing, to have the contact tracing in order to prevent any big spikes of cases. So I think a lot of that data is still coming out. There have been some studies in the last week or so further suggesting that there may be some seasonal effects from the hotter, more humid weather in helping to kind of stem the spread of the virus. But I think all of the experts are expecting that regardless of what we see this summer, that the fall is going to be particularly problematic in terms of transmissions increasing. We're going to need to continue social distancing strategies. That's certainly what was observed in the 1918 flu. You saw it subside during the summer and then come back in the fall. So I think you ask virtually any healthcare expert, and they're going to tell you that this is going to be with us, until there's a vaccine at some point.
There's been a question of if there could be some kind of like immunity passport, a way that you could show that you've had COVID-19, that you've recovered from it, that you might have some immunity to it, but it raises a lot of concerns and questions, both from the health side of things, do we have immunity? And also from the civil liberties side of things. So first of all, Paige, what are other countries doing on this front?
Yeah, I haven't seen any country really implement this successfully, but certainly a few are taking a closer look at this. I know Germany has a couple of other European countries and countries in South America. On the face, this looks really, really appealing, right? I mean, especially when you think about younger people who really have had to bear the economic brunt of the lockdowns and lost income, and they're not the ones that are especially vulnerable to this, but they've had to sort of stay home to protect the elderly that can be hurt by this and have the serious cases. So it seems like a great idea. Like, you have immunity, you have, maybe you have an app on your phone that shows that you can't spread the virus. You can show it to your employer. You can go back to the office. You can go to restaurants, etc. And certainly, I think everybody wants to allow people to re-enter society. There's a lot of hope of that. But I spoke with folks at the American Civil Liberties Union this week, and there's a host of concerns here about sort of the execution of this. First of all, you have you would presume that the employers that would want to use this more would be employers of service sector workers who are not able to work remotely. And of course, those are disproportionately people that are lower income, that are minorities, that are women. And so this could lead to a lot of unintended consequences where maybe, someone really wants to go back to work, they need to support their family, etc. They might be actually tempted to go out and try to get the virus so that they could obtain an immunity passport. You also could see it really incentivizing employers to, hire the people that have the immunity passport and not hire the people that don't. So it's really separating Americans into two categories, not to mention all of the overall privacy concerns about even requiring somebody to take an antibody test, and how would they even show that and store that information on apps, and how that would be shared. So the idea has been tossed around a lot, and there actually are some localities working on apps that would indicate immunity. I know that some of the larger electronic medical record companies such as Epic are working on some ideas along these lines, but it's hard to imagine a scenario in which, the immunity passport idea sort of becomes a really widespread thing and is really an effective tool for trying to help Americans reintegrate into society.
Paige, we're going to try to bring in our colleague, Paul Kane from the Capitol. Let's see if we can get him. Senior congressional correspondent. PK, can you hear me?
I can hear you. Can you guys hear me?
We can hear you. Sadly, we can't see you, but we see a photo of you. But it's good to hear your voice.
That's a younger, better version of me.
Doesn't have the pandemic beard.
No, it does not.
So we are talking to you from the Capitol, and the Capitol was the scene of a lot of activity today. The Capitol sort of, goes between being very, very quiet and a lot of activity, relatively speaking. President Trump was on Capitol Hill today. What was the president doing, and what was the outcome of it?
Well, it was, like many things with Trump, and even some senators said this afterward, from Senate Republicans, it was, he has a lot of ideas and a lot of thoughts, and he wanted to share them. So they announced this morning that he was going to come up to the Tuesday policy luncheons that they hold every week for Senate Republicans. They've now moved them into the big cavernous Hart 216 hearing room, which is usually where you would see a Supreme Court confirmation hearing or something of that level, so that they can be fully spaced out. And so Trump came up, and part of what he was talking about was, the next ideas on coronavirus legislation, but very little on that. More, it was about sort of updating things on testing and antibody testing, and what Paige was just talking about in terms of the vaccine updates. He's very optimistic about that. But then he quickly moved into things that he loves to talk about most, polling and what he has dubbed Obamagate. And it's just the never-ending discussion of how the Russia Mueller investigations began. Eventually, the conviction of the plea bargain of General Flynn, and it devolved into a lot of that talk. Afterward, he came out, stopped for the press, Worth noting that he ended up taking more questions than Senate Republican leader Mitch McConnell, and it's on McConnell's turf. He dodged any questions about that was about Nancy Pelosi's comments about him being morbidly obese last night, in a rare bit of diplomacy from the president. But he then
and Paul, let's just point out what happened. This was in response to the president saying he was taking hydroxychloroquine. Leader Pelosi said that was not recommended. She was hoping that the president of the United States wasn't doing that, both because of his age and because of his weight. And she actually used that phrase, morbidly obese.
Yes. But he then basically, teed off on the FBI, its handling of the investigation into his campaign, repeatedly used the phrase dirty cops, a lot of which, he has done before. Then eventually teed off on Pelosi, but it really had nothing to do with the comments about his girth or not. And it was more about policy. And I think really deep in his heart, it was about him getting impeached by her House of Representatives. It was a lot of sound and fury, but at the end of the day, we're really no closer toward any sort of phase 4 economic health rescue package to fight the virus than we were yesterday, than we were a week ago. So we're still sort of spinning our wheels on that phase of things. We're just sort of waiting and watching. Look, there's still a lot of that phase 3 package that became known as the CARES Act. A lot of that still has to go into effect. Our colleague Erica Warner had that amazing story of a $500 billion fund that only something like 37 billion has gone out the doors yet to help stabilize these massive companies. So there's just still a lot more that has to happen in terms of this first $2 trillion tranche before Republicans are really ready to move on sort of a next phase.
Before we let you go, Paige, I just would love to hear from you. When the president has a moment like this, where the spotlight is on Capitol Hill talking to senators, how much is that like wagging the dog? How much is the president's words and focus affecting the people who are in charge of the health policy right now, who are on the coronavirus task force, who are trying to get the focus? Because so many of the members of the task force are constantly referring to the president and praising the president and saying, the president's efforts to do da-da-da-da. So is this do these changes in focus help or hinder what they're trying to do?
I think if you look back to 2017 and the whole debacle around trying to repeal and replace the Affordable Care Act, I would venture to say most Republicans would say the president was not terribly helpful with their efforts. He would come on to the Hill and say things that were sort of off the wall and make sort of absurd promises about the bill, about things that were going to be in it, which weren't supposed to be in it. And so my thought is that now it's probably something similar. I don't think that the leading lawmakers on the Hill on health policy or the staffers on health policy feel as though the president is someone who's super deep in the weeds on some of these, things, the relief for the hospitals and things like that have gone into the legislation. I know that they look to him for sort of the broad cues about what he would be willing to sign and whether he's interested in another package. But, to a large degree, the president's rhetoric on the Hill largely doesn't always match what is happening behind the scenes as legislation is crafted.
All right. Well, thank you, Paige Cunningham. We'll let you go. PK, it is worth pointing out, though, that the president's offhand comment yesterday about taking hydroxychloroquine changed the whole news cycle, right? So he is the ability to command the news cycle and get the focus of attention either on or off of what he wants.
Absolutely. That was, we have been, for a couple of days, we have been focusing on the fact that he's firing more inspectors general, often on Friday evening when the news cycle has sort of died down. And so yesterday was really the first chance to try and talk to lawmakers coming back, senators anyway. The Senate is in session this week. So in the sort of wave of questions that, we're in sort of a pool sharing situation with a smaller press corps up here because of the virus, at first you could see everybody was asking about the inspectors general, but by 5:30, by 6 o'clock, all of a sudden everybody was asking senators about, hydroxychloroquine and, whether they would take it or not. And then that sort of flowed through today into the lunch. What really happened today that was of consequence was that Vice President Pence and Treasury Secretary Mnuchin came up to the Hill in the morning and had a long 45-minute to hour meeting with Majority Leader McConnell. And if there is ever going to be some sort of next phase of a rescue package, that meeting today was the first one that there was any sort of real sit-down discussion about it. And I think that's where you're going to look to see any progress here. And yes, it will not get the attention because it was behind the cameras. There was not a press conference afterward. You did not have the president talking about dirty cops or, why it's good for him to take a anti-malaria drug that still has not been fully vetted and approved by the FDA. So yeah, he can move. He moves a media needle, but as Paige was saying, on the granular substance of topics, he's not really in the weeds with his own staff and lawmakers.
Such a great point. Yeah, thank you for explaining that. PK, one last thing before you go.
Sure.
The House has now approved a huge change, a historic change, something that we really wondered if they'd be able to do. They're allowing members to cast votes from remotely, from away from the Capitol.
Yeah.
How significant is this development?
It's very significant in the place. We understand Congress. It is just such a tradition-bound, precedent-driven institution. Usually the Senate is more so than the House, just as it's grander and fewer people in the Senate. So any change to the rules becomes a big deal. And, in the Senate, there's always fights over the filibuster and how many votes it should take to end a filibuster. Over in the House, this was the first really big rules change of this magnitude. And in the 25 years that I've been in DC covering this place, it is only temporary, though. It is only during crisis moments where they judge that there is a health crisis and it is dangerous for members to travel here. And, you're only going to have, the reality is there's only going to be sort of 10 people, any lawmaker who's here. So you still have to produce a lot of lawmakers to be here, and they can vote on behalf of up to 10 other members who can't be here. So you're still going to have a House chamber with 100, 150, 200 people there. It's just going to be the person who is caring for, say, a 95-year-old parent who you cannot risk exposure to this coronavirus. And that person is going to be able to sort of put in a written statement saying to the record saying, on this vote, I would vote yes, and instead, Steny Hoyer will vote yes on my behalf. They used to do this in committees up until 1995. And when it was done in committees, it was really back in the era of incredibly powerful chairmen. And basically, the chairman owned you. They owned your proxy. And you basically gave John Dingell or one of those powerful chairmen, Wilbur Wright, you just gave them your vote. And they could walk into any committee hearing knowing they had 25 votes in their pocket. That's not what's going to happen with this. And it is limited. And Pelosi did not want to do this. Pelosi really fought this.
It's funny, Paul, because you think about it from a technology perspective, it seems like a no-brainer, a natural development, welcome to the modern era. But they were so resistant. Leadership was so resistant to this.
Yeah, and what's really been remarkable the last couple of weeks, if you've watched Senate hearings, The Senate has adapted more quickly to technology than the House. The Senate, without having to change any rules, just said, "Oh, you know what? Screw it. Yeah, you can do a remote hearing if you want." So for the first couple of weeks this month, you had these hybrid hearings where some people were in the room and some were back in their offices or their homes talking from afar. Today, you had a fully remote hearing in the Senate Banking Committee with the Treasury Secretary back at his office just off Pennsylvania Avenue, the Fed chair and his office on Constitution Avenue. And then you had the 20 or so members of the Senate Banking Committee in their offices or in their homes asking questions. And if you watched it, it kind of went off without a hitch. I talked to Mike Crapo, the chairman, about it a little while ago. He said, he'd prefer to be in the room, but it was okay. That's the Senate. If the U.S. House can't figure this out, I mean, come on. The stodgy old Senate figured it out. Time for the House to do some of this.
Paul Kane, thank you so much for joining us. I'm sorry we couldn't get you in your face in person, but we have your photo. It's great to hear your voice reporting live from the Capitol. Thank you so much.
All right. See you, Libby. Bye.
All right. Thank you. And thanks so much to all of you for watching this edition of a special report from the Washington Post. We'll be back on Thursday at 3 o'clock Eastern time with more from our Washington Post team. Thank you so much. Be healthy and well.